More than a medical school, Morehouse School of Medicine is an innovative health sciences center, making strides in education, research, and patient care. I'm interviewing Dr. Valerie Montgomery Rice today on the successes of Morehouse School of Medicine in 2018. So, Dr. Montgomery Rice, what is the focus of the Morehouse School of Medicine now?
So our focus now, Monica, is about innovation. Innovation in the sense that, the challenges and the barriers to achieving health equity are not new. Lack of access, underinsured populations, lack of quality, competent providers, culturally competent providers, the disparities that we see in diseases, the expansion of healthcare to those populations that are in the greatest need. Those are not new things. And so what we've been trying to do at Morehouse School of Medicine is to be more than just about access, but innovation against those odds. And the way that we know to do that is to think differently, to really begin to look at healthcare and healthcare delivery with a different lens. We've always thought about it from the patient point of view, but when you start to really bring in the community and to really understand what makes a community, then you can come up with different solutions.
Well, give me an example of that kind of program.
So our community health workers program. So one of the things that we recognize is that care coordination is one of the biggest challenges to achieving health outcomes for an individual and for a community. Most people think about care coordinators as people who have to have a degree, like a nursing degree or a medical assistance license. Well, what we figured out was that high school students could be community care workers, community health workers. And so we started a program a couple of years ago with high school students, letting the high school student become what we call the chief medical officer of the family. So we bring them here for a summer program and we teach them about health care. We teach them about diabetes and hypertension and all other diseases that are common, weight control, okay? All of those different things. Partner them with a primary care doctor, usually someone that's that's taking care of one of their family members, and then say to them, okay, what are the outcomes that you would want your grandmother to have, or your sister or your brother to have who has diabetes, etc. And they monitor that throughout the year. So we've given them some real life skills where they could really be seen as the chief medical officer of their family.
And one day, maybe a student here at Morehouse School
That's right,
of Medicine.
and one day, because we're always planting the seed. We believe that you have to go back into the community to really make a difference. So when you look at our pipeline programs, we are so excited about the partnership that we have with Tuskegee Airmen Global Academy. We adopted that school about now 4 or 5 years, K through 5, challenging in the sense that, there are some socioeconomically disadvantaged students. But what we know is that if you can show a student what's possible, then they can achieve. And so we have about 100 of our employees who function as mentors. We're in that school every day, talking to those students about what's possible, helping them with math skills, reading skills, showing them what it looks like to have a white coat on and that they too can get that white coat.
Well, when you hear you talk about innovation, most people think innovation has to do with technology, STEM, robotics.
Yes, so we are into all of those things, okay? Because technology, to me, if you can democratize, okay, meaning make technology available to everyone, we can change the life and the outcomes for communities. And so what we've decided is that we're going to embrace technology, and we've done that with our robotics program. We have a leading robotics program now at Grady Hospital, our primary teaching hospital, and we are now educating and training providers who were not previously trained in robotics, but all of our residents in training in surgery. Every one of those surgical residents will graduate certified in robotic surgery. So we're excited about that. We're also excited about our telehealth program. We launched that about a year ago. Now that at all of our clinical sites, we also offer telehealth. And so you can establish your first appointment with the doctor through a telehealth visit, or you can continue your appointments with the provider through a telehealth visit.
That is amazing when you hear that. You know, you think about how you have changed how people can interact with medicine. It makes it less scary.
Makes it less scary, and you know what, we recognize that we have to meet patients where they are. And a lot of times, sometimes that's through a cell phone, right? Because most people have a cell phone. Most people have some access to technology, and we know people have other things that are going on in their lives. And so we need to make life and care delivery more convenient for our patients.
But you're also expanding in other ways for your students here at the Morehouse School of Medicine. You've produced some unbelievable physicians, public health professionals, biomedical scientists who are servant leaders.
Yes.
And you are committed to always partnering with communities, as you talked about. But what's new also at Morehouse School of Medicine, where you continue to prepare future health leaders for this changing world of medicine?
Well, one of the things that we're really proud of is that when I became the dean and executive vice president, our class size was 56 MD students. And we had about another 50 or so students in master's and PhD programs. And we were doing pretty well. I mean, 65% of our kids were choosing primary care, 60 to 70% were coming back and practicing in an underserved community. However, when you look at the needs of just the state of Georgia, 119 out of 159 counties underserved, we knew that we could have a greater impact if we expanded our class size. So that's the first thing we did. We expanded the MD program from 56 to 100, which we achieved in 2017. We increased our master's program, our Masters of Public Health program, and our PhD programs by 20%. And this year, we are starting a physician assistance program, and we will enroll the first students in June, because we understand that care delivery is really a team sport. And so we knew that if we started that program, that would give us a broader reach to make a difference.
So do you have to be right here on campus all the time?
Not so. You do not have to be on campus. We have now really several programs that we are offering, what we call through telehealth, tele-delivery. You know, people call them e-courses, people call them a lot of different things, but really they are the opportunity for people to take courses online. Our master's program is our first one that we're kicking off, but we will eventually see multiple gyrations of our programs that are going to be offered online, and some of them will be able to be acquired through a certificate program, and some of them will be a full program. The one that we're really looking forward to jumping off is really our Master's in Public Health, which will be a program for the executive who is still trying to work full-time and really wants to take this as an online program.
That's pretty exciting. Now, I mean, that's expanding your students, but I've noticed when I drove over here today, there's some changes in the neighborhood right across the street. What's going on over there with expansion?
So we are excited about what we describe as our Westside story, okay? So, you know, I sit on the board of the Westside Future Fund, and I am so proud of the work that they have continued to do to really be an advocates for this Westside community. Great work. And so for Morehouse School of Medicine to be able to contribute to that has really made a difference. We were able to do a public-private partnership with Carter, and we have been able to now construct, is in the process, a $52 million development that will have a 30,000 square foot ambulatory care facility that will be available for our students and the students of the AU Center, but also be an outpatient ambulatory care center. We will hope to have a Y there on the first floor, open not just to our students, but the community. and then over 200 market rate apartments.
Wow.
Now, we hope that most of our students will live in those apartments, but they will be open to the community to use also. So we think that this is how we contribute to the economic development of the West Side, and we're excited about it.
That can change the whole economic base of the West Side.
Yes, yes, it will make a difference. And so, as we said, we are contributing with our West Side story.
Okay. I also know you've got a little scoop you want to tell me about. Let me be the first to share this new information, because we keep talking about expansion,
Right.
but it's no longer just expansion here in Atlanta.
It is not. So, we have had the fortune to really have connections with really sort of segments of the state of Georgia. And Columbus, Georgia has been one where Dr. Delmar Edwards was one of our founders. He actually was very significant in helping to start the school. Because of that, we were able to see a legacy being developed of providers who were educated and trained at Morehouse School of Medicine and going back to the Columbus area, but also of the connection of the providers who were there, understanding how important it was for Morehouse School of Medicine to touch people who were going to go back and practice in communities. We know that the highest chance of somebody going and practicing in a community is that they were educated or trained and had contact with their community or from that community. So we're really excited about our regional campus expansion to Columbus, Georgia.
Yay!
So we're excited about that. It will be a 2-year campus where our 3rd and 4th year students will spend part of their time, about 25% of our campus at any time will be there. And then we're hoping to grow our GME programs as well. You know, a lot of times people don't know about the small communities and the opportunities to really impact these communities and what healthcare does when you have a provider there who can really extend the opportunities of achieving health. We know that when providers go into an area, though, not only do they improve the healthcare opportunities, they also improve the economics of a community, because they also have to bring in other people to support care delivery, and it can change the economics of an area. And so we're really excited that when we look across the state of Georgia, you can see Morehouse School of Medicine graduates, whether they're from the MD program or the Masters in Public Health, you can see them out in these communities, these rural communities, making a difference.
Well, that just, I know you're not going to tell me, but I can foresee in the future there will be satellites of the Morehouse School of Medicine all over the state of Georgia.
So Albany ought to get ready for us, because we got our eye on them next, okay? We got our eye on Albany next. And really based upon, again, we believe that we can come there and contribute to the economic opportunities, but also the healthcare delivery opportunities. So we look forward to the partnerships that we will form with Albany State University and the hospitals there to really make a difference.
That's exciting.
Yeah, we're excited.